Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to continue our one more important topic on genetics. First we learn Mendelian inheritance. We learned about that in our previous video, which I briefly given introduction part about genetics and the diseases under which we are going to study. So first, this is the first video, no need to be panic. This is the first video based on Mendelic inheritance. So we have autosomal diseases and X-linked disorders. And in autosomal diseases, we have autosomal dominant and recessive. This is a brush up part. I just discussed this in a introduction video. You can go and watch if you didn't watch that. I kindly recommend that. And we have X-linked disorders in Mendelian inheritance. Even that is divided into dominant and recessive. So in this video, we are going to learn briefly, detailedly, not that detailly, but whatever is required for the exam point of view, I just discussed here. So let's crack it in a exam point of view way. So the topic is autosomal dominant, usually expressed in heterogeneous condition. So this means it won't be expressed in XX like this. It will be expressed in XY condition. So we call this as a heterogeneous condition and this is a homogeneous condition. So this will be expressed in XY condition, so which is heterogeneous condition. So dominant gene is present on one of the autosome. Usually one parent is affected. So recurrence risk will be 50%. If a parent is affected, the child to get to be affected will be 50% for sure. And it is a vertical transmission. So no need to confuse. This is vertical transmission and this is horizontal transmission. There are some conditions where there will be no vertical transmission. There will be only horizontal transmission. Just to not make you people confused, let's keep the autosomal dominant is a good example of vertical transmission. Which means it passes through the generation. This is let's take an example of this pedigree. This is the first generation and this is your second generation and this is your third generation. Generation means your grandfather will be the first generation, then your father and mother will be your second generation and you people will be the third generation. So I think that holds a good example for generations. And then coming to normally there is no skipping or slipping of generations. So this is important point to differentiate between autosomal recessive and dominant. So here there will be no skipping or slipping of generation. So this is a pedigree chart. Let's see pedigree chart along the details. Okay, this will be seen in heterozygous condition. So obviously it will be your father who is heterogeneous. So he is affected. So he'll be having X and Y. So then we have dominant gene, one parent will be affected. So we have one parent affected here. So recurrence will be 50% for sure. So there are 4 kids in second generation. There are 4 kids in second generation and so 50% if we take, it will be 2 kids should be affected. So we can see there are 2 kids affected. So criteria will be passed. Then vertical transmission, as you can see, all generation has been affected. So it is the third criteria will be satisfied. So vertical transmission is seen. Normally there is no skipping or slippage of generation. So you can see it is seen in first generation and there will be in second generation and in third generation there are affected conditions. And usually affects structural proteins. It's a common point. So I hope there is no doubt in what is a pedigree. Let's discuss once again in a short nutshell way. So easy, no need to confuse. I'll try to teach how much ever I can make you people understand. And I think this is sufficient for your exams. Usually it will be expressed in heterogeneous condition. So first generation, it should be heterogeneous. So father is the affected person. Then we have dominant gene is present on the one of the autosome. Then the second criteria is it has to be affected in one parent. So father is affected. And recurrence will be 50%. That means in second generation, if there are 4 kids, then 2 kids should be affected. Then there will be vertical transmission, as you can see, first generation, second generation, and in third generation there are affected kids. Then there will be no skipping or slipping of generation. So it is seen in first and second and third generation. So there is no skipping. Usually affects structural proteins. And here comes what you say. You have to remember what all diseases comes under this autosomal dominant. You can remember autosomal dominant. So A stands for achondroplasia, D stands for dystrophica, myotenia, osteogenesis imperfecta, Marfan syndrome, it is a connective tissue disorder, intermittent porphyria, you will study this in biochemistry. Then neurofibromatous 1 and 2, I'll be making soon video on this NF1 and 2 because it is important chapter under what do you say CNS. So if it is available, you can go and watch. If it is not yet available, I'll be making it soon. Then adult onset polycystic kidney disease. It is a surgery topic, but I'll try to make video or whatever is related to the medicine part. Then Noonan syndrome, no need to worry. I'll be comparing this with the Turner syndrome, as I said. The basic difference will be Turner's will be sex chromosomal disorder, whereas Noonan's is a autosomal dominant. Then we have tuberous sclerosis, and I'll be making a video on this tuberous sclerosis. It is a CNS condition, usually seen in a pediatric cases, but let's cover it in briefly if possible. So in this video, we learned what is autosomal dominant disorders. It comes under Mendelian disorder, inheritance. So we have autosomal diseases and X-linked. In that autosomal diseases, we have dominant and recessive, and we learned very clearly autosomal dominant along with its pedigree and what all criteria it has to pass, and we learned how to remember some good examples and no need to mug up all the examples unnecessarily. I hope